Definitions. Behaviors associated with drug dependence is tolerance to drug effects, which manifests withdrawal symptoms. The drug is the use is actually taking of the drug. Substance abuse, though, is the drug is used in situations of real or potential harm. Tolerance is that you have a required resistance to the effects of the drug. And then withdrawal. Stopping using the drug will result in drug-specific set of symptoms. The definitions. Drug dependent is an inability to control the use of the drug. The craving is that strong, overpowering urge for the drug. And then addiction, the inability to abstain or stop from using the drug. Substance use in society. Now, substances have been used throughout history. Alcohol was mentioned in Old Testament and earlier. Coke was used for over 5,000 years. Marijuana consumption has been used for over 1,000 years, and opium has been available since the Stone Age. Abuse substances. The stimulant drugs will produce excitation, increase alertness, aggressiveness, and decrease food intake. Hallucinogens produce perceptual and sensory alterations. And then central nervous system depressants will decrease central nervous system functioning. The most utilized substances in the U.S. caffeine, nicotine, alcohol, marijuana, volatile inhalants. Although nicotine is considered the most rapid dependence, as it can take anywhere from 7 seconds for nicotine to reach your brain. Substance control efforts. Now, there's probably no other drug that ever became so widely abused so quickly as did tobacco. Then we have the prohibition of alcohol. Harrison Act of 1914 regulated narcotics and cocaine. Other governmental prohibitions and substances still continue to be abused. Nicotine. Now, with nicotine, it does cause physiological dependency. It causes relaxation and excitement, and the withdrawal causes a variety of symptoms. And quitting is extremely difficult, with a relapse of those who try to quit very high, with the relapse of 70%. And nurses involved are on all levels of prevention, and nicotine replacement would be considered a secondary level of prevention. Alcohol causes physiological dependency. It gets in the way of motor and cognitive function, and tolerance can develop. Chronic effects are multi-system, and 60% will have some other medical problems. Withdrawal is also called delirium tremens, or DTs, and Ativan is usually given during detox. Also be sure to check the blood sugar and make sure the patient does not have ketoacidosis. Alcoholic phases. Now, the pre-alcoholic, that they are beginning a tolerance. They're getting to be somewhat of a heavy drinker. They find that alcohol relieves their stress. An early alcoholic is that they drink alone, hiding the alcohol. These are the ones when they start saying, "Hey, where's my booze? Who's opened it?" That would be an eye-opener. A true alcoholic is a binge drinker. They have lost the control over their ability to stop, and many at this point have lost jobs and families. And then chronic alcoholic will have impaired reality testing. Alcoholism, when used, can lead to, when excessive alcoholism could lead to work problems, hazardous practices, legal difficulties, physical problems, memory loss. Wernicke's-Korsakoff syndrome is a manifestation of a thiamine deficiency or beriberi. These are the ones that you see getting the yellow bag, the goodie bag, or the banana bag, the yellow IV bag that has thiamine in it. Because if left untreated, tremulousness, hallucination, and delirium tremors could occur, whereas a seizure would be considered a rare complication. There are social problems, as that alcoholism is higher in women with history of sexual abuse. Treatment. It definitely begins with detoxification. Acetaldehyde is a metabolite of the alcohol, which actually produces a toxic substance. Counseling, group support, Alcoholics Anonymous, that is almost like a behavioral contract, behavioral therapy, re-education, where the patient becomes responsible for their own recovery. Medications, naltrexone, and that prevents cravings and relapse in alcohol, and in some opiate abusers. Cocaine. It causes dependence and tolerance. It blocks the reuptake of neurotransmitters, which results in excess stimulation of brain reward centers. There were studies that showed that lab rats would choose cocaine over food. That crystallized cocaine is called crack, and it is the most addictive. And the equal number of men and women are both in the addiction. One group is not higher than another, but this could result in a cardiovascular collapse. And treatment. Cognitive behavioral therapy is short-term, more focused approach. It does take time and trust. The major challenge in treatment of cocaine dependent is prevention of relapse. One of the things that will help would be residential or outpatient is effective in prevention. Cravings are severely intense, and the personal motivation is an important predictor of success. If they will identify those triggers and stay away from them, those patients will have a tendency to do better. And opiate. Now, heroin is from the poppy flower seeds, and it stimulates endorphins, and it is abused for its euphoric properties, and it creates intense pleasure, but it causes quick dependence, tolerance, and withdrawal. And IV administration increases the risk of HIV transmission. And in treatment, detoxification, basically the same for opioids, alcohol, cocaine, and tobacco, may include a methadone substitution, psychotherapy, the 12-step program, much like what you would see with AA. And nurses will share responsibility with the provider to optimize responsible prescription of the opioids. Hallucinogens cause disturbances of perception and hallucinations. Dependence is rare. Uses increased risk of physical injury. Intermittent use with periods of abstinence. Examples that they may be LSD, MDMA, ecstasy, or mescaline. Inhalant produce behavioral and psychological changes. They can cause permanent neurological damage, aggressive or apathy, poor judgment, may cause death, and often used by adolescents, and the dependence on this is considered uncommon. Cannabis, marijuana, hemp, pot, weed. Now, the effects include euphoria, mental impairments. Psychological dependence is not uncommon. It is not considered, though, a stimulant. It has been shown to be effective in some patients in improving appetite. Drug abuse and families. Now, the impact goes beyond the abuser. It affects the families. Codependence, and that enables the addict to continue abusing the substances. Like a husband would call, say that his wife is sick, and unable to go to work. Encouraging self-help for families, because the hardest part for these families is to let the addict suffer the logical consequences of addictive behavior. When we look at this, they may choose their actions, but they do not choose the consequences of those actions. Nursing and psychological theory. Addiction is so complex, and the part is for us is to attempt to understand the patient, planning those interventions, treat patient for physical needs first, support choices that are helpful in recovery, especially when caring for someone with altered thought processes due to an acute chemical intoxication. The best primary focus for the nurse is to treat the patient for physical needs, and when they're ready to be discharged back to the community, then support them in making choices that are helpful in recovery. Assessment. It begins with the patient history and finding out their pattern of abuse, and then reviewing what those withdrawal symptoms might be. Nurse and diagnosis. Ineffective denial, ineffective individual coping, dysfunctional family processes, or any other diagnosis individual to the patient. Outcome identification. It be what the patient chooses recovery. Again, the patient has to be responsible for their recovery, and that they would establish a lifestyle without substances, a safe withdrawal. They would remain free of substances, and a family will provide support for recovery. Planning and interventions. Establish that relationship with the patient. One of the things we've always said, throughout this whole thing was establish trust. Use kind firmness. Challenge denial. Assist with the necessary life changes, whether it's AA or some other 12-step program, to increase their success. And then evaluation. This is definitely based on outcome. Many will require more than one attempt, and then to support them if they feel that they failed because they could not do it the first time, and be ready to assist when the patient is ready.